Greetings for everyone! We are going to discuss in this video carotid artery disease. Carotid artery disease, also known or called carotid artery stenosis, is the narrowing of the carotid arteries, usually caused by atherosclerosis. Atherosclerosis is a buildup of cholesterol, fat, and other substances traveling through the bloodstream, such as inflammatory cells, cellular waste products, proteins, and calcium. These substances stick in the blood vessel walls over time as people age and combine to form a material called plaque or plaque. Plaque buildup can lead to narrowing or blockage in the carotid artery, which, when significant, can put an individual at increased risk for stroke. Stroke deprives your brain of oxygen. Within minutes, brain cells begin to die. Stroke is the most common cause of death and the leading cause of permanent disability in the US especially, and worldwide. Carotid artery develops slowly. The first sign that you have the condition may be a stroke or transient ischemic attack. A transient ischemic attack is a temporary shortage of blood flow to your brain. Treatment of carotid artery disease usually involves a combination of lifestyle changes, medication, and sometimes surgery. In the early, carotid artery disease often doesn't produce any sign or symptoms. The condition may go unnoticed until it's serious enough to deprive your brain of blood, causing a stroke or transient ischemic attack. Which symptoms include sudden numbness or weakness in the face or limbs, often on only one side of the body, so it's unilateral, depending on the artery that is affected. Sudden trouble to speak and understanding, consciousness, sudden trouble seeing in one or both eyes, sudden dizziness or loss of balance, loss of coordination, severe headache with no known cause, difficulty swallowing, so it's depending on the areas which are affected. Carotid artery disease is caused by a buildup of plaques in arteries that deliver blood to the brain. Plaques are clump of cholesterol, calcium, fibrous tissue, and other cellular debris that gather at microscopic injury sites within the artery. This is called atherosclerosis. Carotid arteries that are clogged with plaques are stiff and narrow. Clogged carotid arteries have trouble delivering oxygen and nutrients to vital brain structures that are responsible for day-to-day functioning. Factors that increase risk of carotid artery disease include high blood pressure, so excessive pressure on arterial wall that can weaken them and make them more vulnerable to damage, tobacco use or smoking, as nicotine can irritate the inner lining of your arteries, so intima of the vessel of the artery. Diabetes lowers your ability to process fat efficiently, placing you at a greater risk of high blood pressure and atherosclerosis. High blood fat levels of low density lipoprotein, cholesterol or LDL, and high levels of triglycerides. Family history. Your risk of carotid artery is higher if you have relatives with atherosclerosis or coronary artery disease. Age. Arteries become less flexible and more prone to injury with age. Obesity. Excess weight increases your chances of high blood pressure, atherosclerosis, and diabetes. Sleep apnea, spells of stopping breathing at night, may increase your risk of stroke. and lack of exercise. It contributes to conditions that damage your arteries, including high blood pressure, diabetes, and obesity. So it's going around the metabolic syndrome. Complications: carotid artery disease causes about 10 to 20% of strokes. A stroke is a medical emergency that can leave you with permanent brain damage and muscle weakness. In severe cases, a stroke can be fatal. Carotid artery disease can lead to reduced blood flow. Carotid artery may become so narrowed by atherosclerosis that not enough blood is able to reach portions of the brain. Ruptured plaques: a piece of plaque may break off and flow to smaller arteries in your brain. The plaques, a fragment of the plaque, may get stuck in one of these small arteries, creating a blockage that cut off blood supply to part of the brain. Blood clot blockage: some plaques are prone to crackling and forming irregular surfaces on the arterial wall. Does exist any conditions to prevent this plaque formation? To prevent or slow the progression of carotid artery disease, we can consider these suggestions, like don't smoke, maintain a healthy weight, limit cholesterol and fat intake, eat a variety of fruits and vegetables, limit salt, exercise regularly, limit alcohol, and control chronic conditions. So, within a few years of quitting, a former smoker's risk of stroke is similar to a non-smoker. Overweight contributes to other risk factors as high blood pressure, cardiovascular disease, diabetes, and sleep apnea. Cutting back on saturated fat, in particular, may reduce the buildup of plaques formation. Vegetables or fruits that contain nutrients such as potassium, folate, and antioxidants, which may protect against transient ischemic attack or stroke. Excess salt may increase your blood pressure. Exercising regularly, you can lower your blood pressure and increase your level of high-density lipoprotein, or HDL. Cholesterol that is called good cholesterol, and improves the overall health of your blood vessels and heart. Limiting alcohol and controlling chronic conditions like high blood pressure and diabetes. Treatment: the goal of the treatment is to prevent stroke. Specific treatments depending on the extent of blockage and stenosis of your carotid arteries. If blockage is mild to moderate, recommendations are lifestyle changes to slow the progression of atherosclerosis. Recommendations may include quitting smoking, losing weight, eating healthy foods, and reducing salt and exercising regularly. So it's a prevention method of treatment mostly. Medications to control blood pressure or lowering cholesterol. Some of drugs are statins that are used widely for this type of patients. I also recommend taking a daily aspirin or other blood thinning medications to prevent blood clots. If blockage is severe or patient have already had a transient ischemic attack or stroke, it's recommended to remove the blockage from the artery, and options are carotid endarterectomy, the most common treatment for severe carotid artery disease. After making an incision along the front of your neck, the surgeon opens the affected carotid artery and removes the plaques. The artery is repaired and with either stitches or a graft. And the second one is carotid angioplasty and stenting is the newest method and less invasive. If the blockage is too difficult to reach with carotid endarterectomy, or you have other health conditions that make surgery too risky, you are given local anesthesia and a teeny balloon is treated by catheter to the area of the clog. The balloon is inflated to widen the artery, and a small wire mesh coil stent, also known as stent, is inserted to keep the artery from narrowing again. So this wire mesh coil is introduced and with balloon is inflated and give some permanent shape, and of course restoring the circulation of the blood in this area. Thank you very much for your attention. Hope this video is useful for you. If it changes a little bit your ability to understand carotid artery disease, you can subscribe and follow this channel.